went to undergraduate school at University of Michigan, go Wolverines. And then I attended Wayne State School of Medicine in Detroit, and I also did fellowship in pediatric infectious diseases at Children's Hospital of Michigan, which is also where I did my residency. Before I relocated to North Carolina, I was probably doing more pediatrics than infectious diseases, but my passion has always been in infectious diseases. I got involved with infectious diseases early on in the HIV epidemic when we started seeing what we called back then GRID, or HTLV3, in babies. And I was taking care of these poor babies that, some of them didn't live very long, and we took care of them when there were no medications available. Pediatric infectious disease fellowship is more than just learning about infectious diseases. I would say infectious disease physicians in general really understand the importance of comprehensive medical care. So you learn about various systems, how they function, the importance of chronic inflammation and heart disease and diabetes and other comorbid and other comorbid problems that people have that aren't HIV infected. So I would say doing an infectious disease fellowship gives you a wide breadth of knowledge. Doing a pediatric infectious disease fellowship, you learn a lot more about the stages of development. So you learn about giving care for kids, or for infants, kids, young children, adolescents, and then young adults. And then along with that, you also learn the various disease processes that can occur in kids who have been infected with HIV over a long period of time. And I think you just get an overall knowledge base that you really wouldn't get in any other subspecialty, because infectious disease docs actually have to know all subspecialties. We have to understand renal function, we have to understand cardiac function, all the disease processes that are involved with the organ system. So I think my infectious disease fellowship, and I trained with very smart people, really prepared me to have the confidence and the foundation to transition into taking care of older people. Sometimes during your training as a resident or as a medical student, you may not be able to see a specialty or a subspecialty as something that you can do, or you may not be able to see that doing infectious diseases may not be for me because I don't want to be an academician. I don't want to run an infectious disease program. The beauty about doing an infectious disease fellowship, and for me a pediatric infectious disease fellowship, was that it allows you the opportunity to do so many other things, to work in the community, to work in public health, to be an advocate, to understand policy behind healthcare. How do we come about the policies and procedures that are initiated for healthcare? And I would like to encourage anyone with a passion to look at all the opportunities that doing an infectious disease fellowship can make available for you. You can do primary care. You can be a politician. You can have your family and spend quality time with your family. You can be an advocate in your community. You can affect policy and procedure in your hospital by being a member or running an antibiotic stewardship program. You can be on the infection control committee and run that. There's so many things that you can do. I actually do think you can have it all. I think infectious diseases allows you to do that. So I would highly recommend it.